I appreciate it. Thank you. Please take a look at our disclaimers and our forward-looking information. I am really excited to talk about the company CareSpan and just a high-level summary of what you'll hear from me. We are really focused on solving one of healthcare's biggest challenges, which is the shortage in primary care and mental health. We have a very differentiated digital technology platform, which is fully integrated. We already have strong validation. We have clinicians on the platform and in the business, which are our own clinicians. And we believe that our secret sauce is a high growth, asset light, and very scalable business model. So just put plainly, CareSpan is both the platform and the provider. So it's technology plus people. And our objective really is to enable and revolutionize care delivery through our integrated digital platform to broaden access, reduce costs, and improve outcomes. Our focus right now is to empower nurse practitioners in primary care, as well as behavioral health providers. Just quickly, and you will have this presentation, and I just want to highlight a few members of the team. There is myself. I have been CEO of the company for 3 years. I joined as an investor. I now am probably the single largest investor in the company. Adrian Robinson is a clinician with many decades of experience. Doug Wolfgram is our Chief Technology Officer. The point I wanted to make here is that everyone in our organization is very steeped in healthcare and has extensive experience in healthcare. In healthcare, whether it's technology, the finance angle, the business side, and so on. In healthcare, actual experience is extremely important, we find, at least in what we're trying to do. On the board side, I'd like to highlight two people. John Reardon is our chairman. He actually was with Trident Capital when they took Teladoc public. And Jim Becker has been with the board for about a year, and Jim ran United Healthcare's Medicare business, and as well as United Healthcare Optum's global solutions business. The big problem that we're trying to solve is that there are so many Americans who are underserved. There's 81 million, according to HRSA. And these are not just poor areas or rural areas. This is where, at a county level, there is a big gap in supply and demand, a small supply and a large demand for primary care. So it's a major problem. And that problem will widen mainly because doctors would rather enter into specialty care as opposed to primary care. And we know this, right? The average wait time, for those of you who are living in the US, the average wait time for a primary care appointment is about 30 days. In rural areas, it's about 40 days. And surprisingly, in a city like Boston, it's 50 days, mainly because most of the doctors in Boston are really specialists. So that's the irony of the situation. When you want and need primary care, which is supposed to be preventive, it's really hard to find. So we first started as a technology-only company, but said, how can we apply our digital technology to this massive problem, right? And we combined this with the notion of empowering nurse practitioners. Nurse practitioners have advanced degrees, and in many states now in the US, these are these green states, they are allowed to practice independently without the supervision of a doctor. The most recent addition to this was Florida, which 2 years ago allowed the practice of independent care by nurse practitioners. And that trend is moving forward as we go. So we believe that the combination of our capability set, as well as our targeting of nurse practitioners, can really make a difference in helping solve the primary care problem. Now, I keep talking about primary care. We're also in mental health. We recently established our mental health capability. The problem there is even bigger, as many of you know. 120 million Americans live in shortage areas in primary care. So our solution right now is to target and enable nurse practitioners and behavioral health providers. But nurse practitioners in independent practice is a fairly new thing in the US, and current solutions do not meet their needs. And many NPs want to get into independent practice, but need a lot of support to start their business, or those who are in business today, they need more support to grow, right? So what we've done is to actually combine our technology and curate a lot of necessary services like rev cycle management, billing and credentialing, cash management, marketing support, both internal and external. So we work with other third parties as well to provide the NPs a complete one-stop shop of capabilities led by our digital technology so that they can focus on taking care of patients. That's the simple value proposition, right? Uh, and why are they able to do this? We have a cost-effective, highly efficient digital platform that actually integrates multiple things. We have remote patient monitoring that's embedded and integrated and native to the platform. Data from that RPM and CCM dashboard is curated to the practitioner on a constant basis. The platform itself is used for in-person as well as virtual care. So there's no toggling between multiple systems, right? Those of you who are interested in demo can obviously call me and take a look at our platform, but the EHR itself is embedded in the platform. And we have a feature called dynamic documentation, which means you can do your exam hands-free. No need for typing things at the end of the session. No need to spend weekends and nights completing your charts. We have the capability. One of the practitioner or the presenters today talked about the Mayo Clinic, right? And the Mayo Clinic, as many of you know, have started this whole care collaboration philosophy. We're able to bring multiple providers in the actual session, both mainly virtually, and family members as well. And finally, we have a very robust patient engagement capability set, which is focused on providing the patient better and more accurate information about their situation, and also educational capabilities like videos and all that. So for example, if a patient is about to enter into some form of surgery, then there's a video explanation they can watch on their own time remotely. How is the platform different from others? Well, the way we view it is that there are telemedicine platforms like Teladoc. There are standalone RPM platforms that are out there. There's also this whole world of electronic health records. We don't compete in any of these. The CareSpan platform is integrated. It integrates these three things and more, which is why we call ourselves the platform, the clinic in the cloud. Now, why is this useful for nurse practitioners from a financial standpoint, right? And this is a model that we basically try to prove over time. We started 2.5 years ago with this model with a handful of clinicians, but we wanted to prove that this actually works. And here, what you see is through our capability set, right? We're able to improve their collection rate. Through the virtual capability, we're able to bring higher patient throughput, so more patients and more patient visits. We are also bringing new contracts to them. So for example, those who follow us will know that we actually entered a contract with the VA where we're providing medical disability exams for returning veterans from the US military. I spoke about the capability of remote patient monitoring, which is a direct reimbursable capability, and so is chronic care. In this model, and we've proven this out with the first 2 clinicians that have joined us 3 years ago, or 2.5 years ago, that their net earnings can actually triple in this situation, right? So depending on, of course, where they start, but there's a tremendous potential for growth. And we're tapping into that and accelerating that growth for our members. Our revenue model is pretty simple. We collect billings from insurance, and we return 84% to the provider, and we keep 16%. But where the profitability really kicks in for us, CareSpan, is for remote patient monitoring and chronic care management, which has a 50 to 70% return for us, right? And we give 30% to the provider. And over time, our plan is to obviously service this part of the market. 20% of Americans have chronic illness or have markers of chronic illness, and together with a care plan, they are they are candidates for remote patient monitoring. So that's how we've modeled our business. We aggregate providers and patients on the left-hand side, and then we bring in remote patient monitoring and chronic care management to those who need it. RPM is going to be viewed as a high growth area in healthcare. A lot of folks are in this space right now, but we are in it from an integrated standpoint and focused on nurse practitioners. So we think we're in the right space with RPM. So if you look at our model, it really has three legs, right? One is we expand the network. That's our strategy. We provide value added services and we provide payer contracts. So it's kind of a network effect, so to speak, as we grow the business and scale it. Thus far, we have enjoyed really good customer traction. We're still a fairly young company, and we ended 2021 with close to $6 million in revenue. And that was a 65% increase from last year, from 2020. And then we announced Q1 results as well this year, where we grew 60%. So our current run rate, we now have about 100 clinicians in the network, and our goal is to get to 1,000. Remember, one would say that's a small number if you look at the number of NPs, especially in the independent practice states. So a real target is about 80,000 NPs, right? So 1,000 would seem small, but if you consider not a lot of them really want to go into independent practice, then you need to find those who do and those who can be anchor practices to others. But we now have the formula to scale. Our secret sauce really is the templated approach for a practice, for a nurse practitioner to grow. And we believe we can be a $100 million business in 2-3 years with a 20% EBITDA. So how do we grow the network? We have a dedicated internal network development team. We have partnerships with complementary groups of nurse practitioner organizations. We have a very strong referral program and influencer marketing. We're excited about the collaboration with educational institutions like South Dakota State University, who have a strong online education program for nurse practitioners, and so does Western Governors University. And going forward, we will selectively acquire clinics and practitioners to join the network. Right? I will skip the cap table and all that. We're on the TSX. We obviously believe we're way undervalued, but that's a different discussion. But interestingly, the software and the capability set is designed, while we are focused on nurse practitioners and mental health right now, it really is designed for broader market applicability. Specialist providers, home care, physical therapy, wellness, and so on, and also international, right? We now have initial discussions with a group in Germany and a group in Southeast Asia to implement the CareSpan model in those locations. I just want to end by saying that folks invest in us for really 5 reasons. The sector obviously is attractive, and that's why I guess you're attending this conference. We are addressing a large unmet need of the shortage in primary care and mental health, and a significant opportunity. Our solution is differentiated, which is technology plus people. So an integrated, cost-effective platform and business services around it. And a validated solution. We've proven that it actually works, right? We started slow and are now at a stage where we are prepared to scale. The model itself is high growth and asset light, which is why we believe it's very scalable. We're not dependent on establishing brick and mortar clinics, right? We are very proud of the deep healthcare experience and strong track record of the team that we have. So let me stop there, Gilbert, and take any questions that the participants might have.
Sure, Ambert. The first question coming off here called Weefam. He's asking, is the high involvement of digital technology in healthcare, does it make it more expensive or what do you think of that?
It's actually the reverse. It makes it cheaper, right? So the cost of technology is going down. instead of just having your blood pressure or your vitals taken whenever you visit your clinician, you can take it on a continuous basis every day, and that data can be streamed, right? So it actually makes the cost of care delivery cheaper. Then the digitization of the electronic record makes it easier to handle, right? I can use my voice, I can dictate my notes with a great degree of accuracy, and that reduces the entire cost of the encounter itself.
Cool. The next one from Siles, he's asking, there seems to be some similar companies in the market space for the digital health. How do you stand out? Is the competition high?
No, the competition is actually not high, right? Our focus on nurse practitioners and mental health providers with our technology is pretty unique. So we go to market with people plus process plus technology, right? It's not just a pure play technology play, it's technology plus people. And we believe that by doing that, we can address the last mile problem of the shortage more effectively.
And he's asking you next, what's your current burn rate?
Yeah, we're burning about 150,000 a month, and we should get to cash flow positive in Q1, Q2 next year. That's our estimate with the growth in revenues and cash.
Yeah, and I think this is the last question here. Are you from Talon Tang? He's asking if you're getting ready to enter other markets like Canada's market.
Yeah, well, Canada for sure, but right now we're still focused in the US where the problem is massive. Canada actually has a relatively good primary care system, but yes, Canada can also use our approach. But the interesting part is international. It's wide open for us. We now have a couple of conversations with a group in Germany for elderly care and a group in Asia for care for the masses. Because of our cost-effective approach.
Sure. And one last question here. What will be your major risk in moving forward to grow your business? Is that execution risk right now only?
Yeah, yes, absolutely. Just heads down, focused on execution, making sure that what we've promised to deliver and what we've created as a package of technology and services actually work and work seamlessly. And, yes, we're heads down, execution focused.
Thank you, Robert, for addressing all these questions. Thank you for your time and sharing your story with us here.
Thank you very much, Clifford.